Let me start with a question. What is the one medical condition that has killed more children under the age of 5 worldwide than malaria, measles, and AIDS combined? Most people guess something exotic, something rare, something they've never heard of. The answer is diarrhea, not a tropical mystery illness, not a designer virus, something so common, so ordinary, that we joke about it, we whisper about it, and, most dangerously, we underestimate it. Good evening, everyone. I'm a physician, and I've spent my career in clinics and emergency rooms watching two very different versions of this story play out. In one version, a family recognizes the warning signs early, manages symptoms wisely, supports the body's natural recovery, and everyone is back to normal within a few days. In the other version, a family waits too long, treats it as just a stomach bug, and ends up in an emergency room with a dangerously dehydrated child or an elderly parent whose kidneys are struggling because nobody realized how much fluid the body was losing. I'm not here tonight to frighten you. I'm here to arm you with real medical knowledge in plain language about something that touches nearly every household on this planet. Because whether it's a stomach virus tearing through a school, a bacterial outbreak from contaminated food, or a bout of traveler's diarrhea that ruins a vacation, the truth is this: diarrhea outbreaks are common, they are largely preventable, and they are almost always manageable, if you know what your body is telling you and how to respond, both naturally and medically. Tonight, we're going to talk honestly about explosive diarrhea outbreaks, what causes them, how they spread, how your body reacts, and, importantly, how you can support your recovery using natural, evidence-based strategies, while also knowing exactly when it's time to call a doctor. 2. Introduction to the topic. So, what exactly do we mean by an explosive diarrhea outbreak? In medical terms, diarrhea is defined as the passage of 3 or more loose or watery stools within a 24-hour period. Explosive diarrhea simply refers to a particularly sudden, forceful, and high-volume presentation, often accompanied by cramping, urgency, and sometimes audible bowel sounds that patients describe, only half-jokingly, as their stomach declaring war. An outbreak means that this is happening to a cluster of people at the same time: a family, a classroom, a wedding party, a cruise ship, or a whole community, usually because they've shared a common exposure: the same water source, the same meal, the same daycare center, or close contact with someone who is already ill. Let's define a few terms simply, because medical language often creates more fear than clarity. Gastroenteritis simply means inflammation of the stomach and intestines, the medical umbrella term for what most people call a stomach bug. Dehydration means your body has lost more fluids and electrolytes than it has taken in. Think of it as your body's internal water reservoir running low. Electrolytes are minerals like sodium, potassium, and chloride that carry electrical signals in your body, controlling everything from your heartbeat to your muscle function. Oral rehydration therapy, which we'll discuss in detail, is simply the medical term for replacing lost fluids and salts by drinking a carefully balanced solution. Why should you care about this topic? Because diarrhea is not a minor inconvenience. It is one of the leading causes of preventable illness and, in vulnerable populations, death worldwide. It is also one of the most common reasons people miss work, miss school, cancel vacations, and end up in urgent care. And in outbreak settings, understanding how it spreads can mean the difference between one sick person and 20. 3. Medical explanation. Let's talk about what's actually happening inside your body during an episode of explosive diarrhea, because understanding the mechanism takes away much of the fear and replaces it with confidence. Your intestines are lined with millions of tiny finger-like projections called villi. Their job is to absorb water, nutrients, and electrolytes from digested food as it passes through. Normally, this is a calm, efficient, one-way process. Nutrients and water move from your gut into your bloodstream. Now imagine an intruder arrives, a virus like norovirus or rotavirus, a bacterium like Salmonella, E. coli or Campylobacter, or a parasite like Giardia. Your intestinal lining reacts the way any defense system would. It goes into high alert. Here's the analogy I like to use with my patients. Think of your intestines as a security checkpoint. When a threat is detected, three things typically happen simultaneously. First, the intestinal wall becomes inflamed and less able to absorb water properly. So instead of water being pulled into your body, it stays in the gut, or is even actively pushed into the intestine to help flush out the invader. Second, your intestines speed up their contractions, a process called peristalsis, to physically expel the offending organism as quickly as possible. This is why the diarrhea feels sudden and forceful. Your body is essentially hitting the emergency evacuation button. Third, in some infections, bacteria release toxins that directly stimulate the intestinal cells to secrete even more fluid, which is part of why certain bacterial infections cause such dramatic, high-volume, watery stools. This is, in a strange way, your body working exactly as designed. Diarrhea is often a protective mechanism, your body's way of rapidly clearing something harmful. The problem isn't that your body is malfunctioning. It's that this rapid-fire defense system can cause you to lose dangerous amounts of water and electrolytes very quickly, especially in young children, older adults, and anyone with an already compromised immune system. Common causes of outbreak-style diarrhea include viral infections. Norovirus and rotavirus are the most common culprits in schools, cruise ships, and daycare centers, spreading through contaminated surfaces, food, or close contact. Bacterial infections, Salmonella, E. coli, Campylobacter, and Shigella, often linked to contaminated food or water, undercooked meat, or unwashed produce. Parasitic infections, Giardia and Cryptosporidium, often linked to contaminated water sources, including untreated lake or well water. Food poisoning, from toxins produced by bacteria like Staphylococcus aureus or Bacillus cereus in improperly stored food. Risk factors that make outbreaks spread faster include crowded living conditions, inadequate hand washing, shared food and water sources, poor sanitation infrastructure, and close contact settings like schools, nursing homes, and group travel. 4. Symptoms and warning signs. Most cases of explosive diarrhea, while unpleasant, follow a fairly predictable and self-limited course. Common symptoms include frequent, loose or watery stools, abdominal cramping and bloating, urgency, a sudden, strong need to reach a bathroom, nausea, and sometimes vomiting, low-grade fever, fatigue, and general malaise. For the vast majority of healthy adults, this runs its course within 2 to 4 days. However, there are warning signs that should never be ignored, signs that tell you this is no longer a wait-it-out situation, but a seek medical care now situation. Signs of significant dehydration, dry mouth, minimal or no urination for 8 hours or more, dizziness or lightheadedness when standing, sunken eyes, or in infants, a sunken soft spot on the head and lack of tears when crying. Blood or mucus in the stool. This can indicate a more serious bacterial infection or inflammatory process. High fever, particularly above 102 degrees Fahrenheit, 39 degrees Celsius. Severe abdominal pain that is persistent or worsening, rather than crampy and intermittent. Diarrhea lasting more than 2-3 days without improvement, or diarrhea that keeps returning. signs of confusion, extreme lethargy, or fainting. In infants, young children, pregnant women, older adults, or anyone with a chronic illness or weakened immune system, the threshold for seeking care should be much lower because these groups can deteriorate quickly. I want to be very clear about one thing. I am not diagnosing anyone in this room tonight, and I would never encourage you to self-diagnose a specific illness based on a speech. What I am giving you are general warning signs recognized in medicine, patterns that tell you it's time to let a trained clinician examine you rather than relying on guesswork. 5. Diagnosis and medical evaluation. When someone comes to a clinic or emergency room with explosive diarrhea, especially during a suspected outbreak, doctors typically approach it step by step, and I promise you, it's far less intimidating than it sounds. First, we take a history. How long has this been going on? What does the stool look like? Has there been fever, vomiting, blood, recent travel, recent food exposures? And has anyone else nearby been sick? This single conversation often tells us 80% of what we need to know. Second, we perform a physical examination, checking hydration status by looking at your mucous membranes, skin elasticity, heart rate, and blood pressure. This is simple, non-invasive, and tells us how urgently we need to intervene. Third, if needed, we may order a stool test, sometimes called a stool culture or stool PCR panel, which can identify whether a specific virus, bacterium, or parasite is responsible. This is particularly important during outbreaks because identifying the exact organism helps public health authorities contain the spread. Fourth, in more severe cases, we may check blood tests to evaluate electrolyte levels and kidney function, since significant fluid loss can affect both. I always tell my patients, you don't need to understand every test to trust the process. Your job is to describe your symptoms honestly and completely. Our job is to translate that information into an accurate picture of what's happening in your body. 6. Treatment and management. This is the heart of tonight's discussion, because this is where you have real power to help your own recovery. The single most important treatment for diarrhea, bacterial, viral, or otherwise, is rehydration. I cannot overstate this. More people are harmed by dehydration during a diarrheal illness than by the original infection itself. The gold standard, recommended by the World Health Organization and physicians worldwide, is oral rehydration solution, ORS. A precise, evidence-based mixture of water, salts, and sugar that helps your intestines absorb fluid far more effectively than water alone. This isn't an alternative therapy. It is one of the most life-saving medical interventions in history, credited with saving tens of millions of lives globally. You can buy pre-made ORS packets at most pharmacies, and they are inexpensive and shelf-stable. Alongside rehydration, here are evidence-supported, natural approaches that complement medical care. The Brat Plus approach. Bananas, rice, applesauce, and toast are gentle, low-fiber foods that are easier on an inflamed gut, though modern guidance encourages returning to a normal, balanced diet as soon as it's tolerated, rather than staying on bland foods for days. Clear broths and soups provide fluid, sodium, and a small amount of nourishment. Probiotics, particularly strains like Lactobacillus, Rhamnosus GG, and Saccharomyces boulardii, have reasonable evidence supporting a modest reduction in the duration of infectious diarrhea, especially in children. Yogurt with live active cultures can be a gentle, food-based source, though supplement forms are more concentrated. Ginger tea, taken in modest amounts, has long been used to settle nausea and may offer mild symptomatic relief, though it does not treat the underlying infection. Peppermint, in moderation, has some evidence for easing cramping and bloating in irritable digestive states, though during acute infectious diarrhea, it should be used cautiously and not relied upon as primary treatment. Rest. Your body is fighting an infection, and sleep supports immune function. Now, let's talk about what natural approaches should not replace. Antibiotics, when a bacterial cause is confirmed and clinically indicated, are not something to avoid out of fear. They are prescribed carefully by physicians precisely because certain bacterial infections carry real risk if untreated. Anti-diarrheal medications like loperamide can be helpful in select uncomplicated cases in adults, but they should generally be avoided when there is high fever, blood in the stool, or suspected bacterial infection, because slowing the gut down can sometimes prolong the infection or worsen certain complications. This decision should always be made with a healthcare professional. Intravenous fluids, given in a clinical setting when oral rehydration isn't enough, are sometimes essential and life-saving. This is not a failure of natural approaches. It is simply a higher tier of the same goal: getting fluid back into the body. The most important message I can give you in this section is this: treatment should always be personalized. What's appropriate for a healthy 30-year-old with mild symptoms is very different from what's appropriate for an 80-year-old with heart disease, or an infant, or someone who is pregnant. Please use tonight's information as a foundation for good conversations with your doctor or pharmacist, not as a replacement for their individualized guidance. 7. Prevention and healthy habits. If there's one section I wish everyone would tattoo onto their memory, it's this one. Because diarrheal outbreaks are, in large part, preventable. Hand washing remains the single most powerful tool we have. Proper hand washing, with soap for at least 20 seconds, especially after using the bathroom and before preparing or eating food, dramatically reduces transmission of the viruses and bacteria responsible for most outbreaks. Food safety matters enormously. Cook meat and eggs thoroughly, wash fruits and vegetables, avoid cross-contaminating cutting boards, and refrigerate leftovers promptly. Most bacterial outbreaks trace back to a single point of contamination in food handling. Water safety. If you're traveling to an area with uncertain water quality, stick to bottled or boiled water, avoid ice made from tap water, and be cautious with raw produce washed in local water. Vaccination. The rotavirus vaccine, given to infants, has dramatically reduced hospitalizations from one of the most common causes of severe childhood diarrhea worldwide. A genuine public health triumph. Isolation during illness. If you or a family member is sick, staying home from work, school, or gatherings for at least 24-48 hours after symptoms resolve can prevent an isolated case from becoming a full outbreak. Gut health maintenance. A fiber-rich, varied diet, regular meals, adequate hydration, and, where appropriate, probiotic-rich foods like yogurt and fermented vegetables support a resilient gut microbiome, which may offer some baseline protection against infection. None of this requires perfection. It requires consistency. 8. Common myths and misconceptions. Let's clear up a few things I hear constantly in clinic. Myth: stop eating completely until it passes. Reality: prolonged fasting isn't necessary and can actually slow recovery. Current guidance favors continuing to eat small, easily digestible meals as tolerated, alongside rehydration. Myth: diarrhea is always caused by something you ate. Reality: while foodborne illness is common, viral infections spread person to person are actually the leading cause of outbreak-style diarrhea, especially in schools and group settings. Myth: you just need to drink plain water to rehydrate. Reality: water alone doesn't replace lost electrolytes and can, in significant fluid loss, actually be less effective than an oral rehydration solution, because your gut needs the right balance of salt and sugar to absorb water efficiently. Myth: natural remedies are always safer than medication. Reality: natural doesn't automatically mean harmless or sufficient. Herbal remedies, high-dose supplements, or unproven detox regimens can sometimes cause harm, interact with medications, or delay necessary medical treatment. The safest approach is always to combine sensible, natural supportive care with professional medical guidance, not to see them as competing philosophies. Myth: if antibiotics exist, doctors should give them for every case. Reality: most diarrhea, especially viral, will not respond to antibiotics at all, and inappropriate antibiotic use contributes to antibiotic resistance, a serious global health problem. This is why testing and clinical judgment matter. If I could sit with each of you individually tonight, here is what I would say. Your body is remarkably intelligent. An episode of diarrhea, uncomfortable as it is very often your body doing exactly what it's supposed to do, protecting you. Your job is not to panic, and it's also not to ignore it. Your job is to listen, to notice how much fluid you're losing, how you're feeling, whether you're improving or worsening, and to respond with the right blend of home care and professional support. I want you to feel empowered, not anxious. Empowerment looks like keeping oral rehydration salts in your medicine cabinet the way you keep a first aid kit. It looks like knowing the warning signs so well that you don't have to wonder. You simply know when it's time to call your doctor. It looks like teaching your children to wash their hands not out of fear, but as an act of care for themselves and everyone around them. Health isn't the absence of illness. It's having the knowledge and the calm confidence to respond wisely when illness happens, because it will, at some point, happen to all of us. Let's go back to where we started. Diarrhea, as ordinary and unglamorous as it sounds, remains one of the most significant health challenges in the world, precisely because we underestimate it. But tonight, you are no longer someone who underestimates it. You understand what's happening in your gut when illness strikes. You know the warning signs that separate "ride it out" from "go get help." You know that rehydration is your single greatest tool, that gentle nutrition and evidence-based natural supports can ease your journey, and that natural care and medical care are not rivals. They are partners in the same mission, getting you back to health safely and quickly. If you remember only one sentence from tonight, let it be this: listen to your body, replace what it's losing, and never be afraid to ask for help. Take care of yourselves, take care of each other, and wash your hands. Thank you.